If you're cleaning the wound with the cotton-tipped applicators, you need to bring a bunch, okay? You need to get some gauze pads. You need to get, I didn't bring that solution, sterile solution, you have that as well. And then some, and then clean gloves. Okay, so you're gonna set everything up on the bedside table. So you're gonna start with coming to your patient and you're gonna identify yourself. Hi, Mr. Jones. I'm Mary. I'm gonna be changing your wound dressing today. Can you tell me your name and date of birth? Okay, he's not gonna talk to you. Okay, so don't expect a response back. But we do want you to go through that step just to get you in the habit of doing that, okay? I'm just gonna put my trash can about right there. And then the other thing is when you're going through the procedure, you don't have to say everything that you're doing. Like, so here, hand sanitizer is over there, but let's just say I do that. Okay, now I'm putting hand sanitizer. Don't say that. We can see you doing that. Okay? And don't do this. Okay, now I'm applying clean gloves. We see you. You would never do that in a patient room anyways, right? All right, so Mr. Jones, what I'm going to do is I'm going to take off your old dressing here. So I'm just going to uncover your wound and cover you up here. Sorry, Mrs. Jones. Okay, so there's going to be a little tape pulling here. I'm sorry about that. All right, so at this point you're just going to look at the dressing. You're going to look at the wound itself. If there's not much drainage in there, and it doesn't look like there's much compromise to the skin around there, then you don't have to come back and touch it or anything like that. Okay, so you can just get rid of the old dressing. All right, you're going to sanitize your hands one more time. If you feel like you do need to come back and get your hands close to the wound, near the wound, you do need to put clean gloves on, okay? And because you never want to touch anywhere around the wound without some kind of barrier on your hands, okay?
How are you going to be able to, because I know like for around the wound they want us to check like temperature and texture, and how can we do this? We have gloves on.
It's a challenge.
Okay, but it is doable. It's not like there's some special procedure.
Exactly.
You just put on gloves and do the best you can do.
Exactly.
But Ms. Irby, as far as this, it's not necessary if we don't see anything.
Exactly.
Okay.
We are going to work on getting some drainage going though. I talked to Ms. Fix about that, so you may have some, so you know what the different types of drainage look like, because you will need to describe that and about how much of the pad or the dressing that is saturated. All right, so I've got all my sterile things here. I'm actually going to move these here because I would have my, actually no, I'm going to put it here, and I would have my solution here, so over on the side. And then I'm going to start opening up my packages. Remember, everything that's inside the package is sterile. And these little packages do get a little tricky. Like, see how that one tears kind of funny? So just work with it the best that you can.
You wouldn't have to open it all the way, would you?
Well, the only thing about these particular ones, yeah, just contaminated, but I was going to say maybe you can grab it a little bit on the outside. If you do not pull it back all the way, that cotton tip is actually larger than the stick part, and they will stick in that package. And so then you're fighting it to get it off of there. Okay, so I'm going to open this one.
Like, would you like dump them on your sterile?
Well, not right now because I don't have a sterile field just yet. Okay.
We would in the practicum.
No.
Oh no.
That's what I'm saying. You're not going to have that.
That's what I was asking, remember?
Okay, so those are both open. And then I would open this package as well.
It's going to be too full to send to me.
And what's sterile is inside the packages. Okay. So here's how you can use your gloves as a sterile package or sterile drape or area. So if you reach in to get your gloves and you're only touching on the top, you have not contaminated the space underneath. Okay. So everything in that package is still sterile because I touched nothing on the surface.
Okay, so I have a question. How are you gonna pour your fluid?
Oh, I forgot about that, sorry.
Oh.
Go back.
Oh, because it's not in front of you.
Yeah, it's not in my brain. Okay, hold on. Thank you.
Because we were just up there talking to Miss Bunn about this, and I was following you all the way to the one hand, and then I
Yes.
was like, ew.
Yeah, I gotta remember why I just put one glove on. Thank you for saying that.
Okay.
I'll work that out in just a second. Okay, yeah, so I've got one sterile hand, and so you need to do a couple of things. You need to, what some people are doing is they're just moving everything out of that package and putting it here, and then pouring the sterile solution in there. But do you see how I just manipulated that just a little bit to get over there to it? So just remember, I'm dirty, so I can touch anything on the outside here. The other thing that I would do at this point is I would probably move these onto my sterile field, just because that's a tricky little area. And then you come over here, you're gonna pour your solution in there, and then you're all ready to go, okay? Now I do my other hand.
So you unscrew the cap with one hand?
Yeah.
Yeah. I would have cut it. All right. So I'm just using this space in between here, so you can come around, get that all wet. Wipe down. Toss. You see how I'm going around the sterile field? So it's very important that you don't go over the top, wherever you placed it on there.
Would we be using our pads, or would we be using our Q-tips? Or
You-
cotton
you
swabs?
use- If
or-
you use those, you're gonna have to use a bunch, because this is a big wound.
Okay.
And this is a dry one. All right. Now, I need to pack it, so I'm gonna take this one that has previously been wet, and I'm gonna wet it here. Wring it out. And I think most of you guys have seen me do it this way, right? Where I go like this?
Feed it out of the bin.
Right, exactly. And you're gonna cover all the surfaces of the wound. Just using your Q-tip to work it in there. If this was wet, which yours will be, it'd be a lot easier to feed in there. Okay. Always keep your hands up, not up, but waist or above. Place that over the top. And then nothing needs to be sterile anymore, then you just tape it, okay? So if your hands are visibly soiled, you need to change out and put clean gloves on to finish up, do the tape and all that. If they're not soiled, you can go ahead and do the tape and then clean up your area with the gloves that you have on, okay? Yes.
If these weren't our practice sterile gloves, like if it was a real scenario, we would just throw away the whole sterile field?
Yes. Yeah, once you're done, it all just gets scooped up. And remember, if you're doing it on the bedside table, if you were really in a hospital, then you would come and clean the bedside table, because they eat off of this too.
And
Okay.
can that just go in the trash can, or does it go in the biohazard?
Biohazard, any wound drainage is gonna have to be gotten rid of in a biohazard
So
bag.
would you just take it out of the trash can?
No, I would take, if I didn't have a biohazard bag in the room that I'm putting it into, I would take that out of there and put it in a biohazard bag. And remove all of it. Remove all of it. Yeah, you're not gonna reach down in there and pull it out. Okay? You guys have any questions? So there's